Okay, hi guys, how are you?
I'm good.
Great. How are you?
Good.
So my name is Aqsa,
I'm Rebecca.
And I'm Ayaan.
and we just want to thank you for so much for agreeing to do this with us. We really appreciate it. And if it's okay with you, we can get the interview started right away.
Sure.
Awesome. So to kind of start off, I was wondering if you could tell us your name and just a little bit about your journey so far and how you dealt with any stress and pressures that you had along the way.
So my name is Dr. Priyanka Mathur, and I'm the founder and CEO of MediPocket. And how I started on this journey is because of my passion in healthcare, which started at a very young age when I was literally, I would say, like 6 years old. And since then, I wanted to be a doctor. And I was like, okay. And I pursued that. I didn't realize how hard and long this journey is, but that is how I pursued. That was my passion. I went to Russia to do my med school, went back to India and practiced medicine there before coming to United States. While being in the system firsthand of the three countries, healthcare system of three countries, I realized that there's a common, I would say common vacuum in the system where the patients get lost. They're overwhelmed. In some system it is expensive, and in most systems it's fragmented. So that is when I was clinically in this. I realized, I mean, there's much more smarter doctors that can clinically treat people than I am. But how about we can try to simplify the system for patients. So the goal or the vision and the mission for MediPocket of starting this is to bring power in patients' hand, so they can get engaged in their own healthcare, so they can be a better advocate of it. So that is why I started, and that is how the MediPocket is and what this is what MediPocket is working on. About the obstacles and challenges that comes every day in various forms when you get into that journey. Especially in my case, I would say it's because I'm a medical person, have no technical knowledge, and the other barriers are being a female, non-technical, and an immigrant. So there's like layers of obstacles and layers of challenges that I have to I face every day. But that makes the journey more interesting, and I would say it keeps it in a momentum, because if it's like everything good, you get bored with that kind of like, achieving every milestone. It's much fun. And then when it's like, okay, now I have another struggle to do, I have another obstacle to jump from, and stuff like that. So that has been a journey. I like challenges every day, and I never think about them. In a way, I mean, it's not I never think, but I don't prepare myself, because I was like, okay, whatever comes, I will take it from there. Sometimes people is like, oh, you need to be well prepared, and you need to, understand what you're getting in. It's really hard. You cannot know everything before getting in something. So what I did after my first few, I would say, months in entrepreneurship is like, I'll be prepared, whatever comes. It's me who has to solve it. There's no help. There's no above me. There's like, oh, can you go and help me? It's like me and my team is dependent on me. So that is how I handle anything that comes my way.
That's so inspiring, especially about being able to be flexible with the obstacles that come in your way and being put in a situation where you have to figure out what to do from there instead of already having prepared something. Do you mind telling us a little bit more about the MediPocket and like what's the goal of the app? I know you elaborated a bit, but maybe just a little bit more. And how does it function? And what led you to create the app?
So creating the app is, as I said, is like, I want to bring that transparency, affordability, and accessibility to the primary care system. So the goal with MediPocket is creating a micro care ecosystem where the patients are at its heart, and they're involved, engaged, and organized. How we are doing it is by tackling few verticals, because again, in our order to create an ecosystem, you need to have few verticals working together. And that is what with MediPocket we are doing. We are addressing the vertical of being expensive by making it affordable. How we are doing it is through the prescription. Now, if you take the statistics, 1 out of 4 Americans that are taking prescription drugs says it's difficult to afford their medications, which leads to decrease in adherence and inefficient treatment outcome. So the healthcare system, talking alone about the US, ranks #1 in the expenditure. In 2019, we literally spent around $3.5 trillion on just healthcare, which, on healthcare system, making us #1 in expenditure, but number 36 in the position of the quality of care, which is very well, we can see how the COVID was being held, the COVID situation being handled. It's not that any system was prepared for that, but being the most advanced healthcare system on the earth, we could have handled it more efficiently if we would have focused on the healthcare system before this pandemic came. But healthcare system was never put as a priority by the government, and by it was always on the back seat, and that is why it was not handled as efficiently as we could have handled this pandemic. But so that is the goal of bringing it, the prescription. Now, how we are handling the affordability of the prescription is in MediPocket offers this free discount card that help users to save up to 80% on their prescription drugs and over-the-counter medications at any pharmacy in the United States, Puerto Rico, and Hawaii. What they have to do is they just literally take this discount card, physical or on the app, and then they show at the time of checkout. The cards are activated, they have this all BIN and PCN number, and they do the direct saving. It's like, I always call it like on-demand saving. So there's no approval needed. There's no approval from the insurance company, because if you know how the prescription system works, is like you need to submit it to the insurance, they approve it, and then is how you get it filled. But in this, it's right there and then. You do the savings, you take your prescription. So that is one thing that we have done. The other thing, so we are partnered with 75,000 pharmacies across the country, which is CVS, Walmart, Walgreens, Rite Aid, all major pharmacy chains. So we do not ask users to change the behavior or only go to this pharmacy to get a discount. It's like, no, you use the app to compare the prices, you find the lowest price pharmacy and go to that pharmacy based on your preference of being closer or whatever your difference between the distance and the pricing is. But you can go to the pharmacy of your choice and use the discount card absolutely free. It never expires. One card can be used by all your family members, and not only all your family members, but also for your pets. So you can use this card for the pet prescriptions also, which I think pets are as much a part of a family than, other family members. So that's very interesting, and it's getting a huge market traction, because it's only two things that you can have people try something, is either you give them money or you save money. We cannot give money because we don't have that much money to give, but we can always save money. So that is what we are doing, is we are helping people save money and afford the medication in order to increase adherence and resulting in an efficient treatment outcome. The other vertical that we are doing is on-demand prescription delivery, which is again a unique approach that we are doing. There are pharmacies that are called as online pharmacy that do the free delivery. But in that case, you have to ask a user to change the behavior and get the prescription transferred to that particular pharmacy. But what we are doing is, like, you choose pharmacy, we just act as a last mile delivery service, picking from there and delivering you. Now, because this is not as simple as it look on the back end. It is a lot of, because we are dealing with prescription medication. It has layers of encryption, layers of security applied to it, because it's not the food that anybody can pick up and anybody can eat it. It's prescription medication. So there's layer of, the security that we have applied, but this is again a different and a unique approach that MediPocket is doing, is making the prescription drugs delivered on demand from their choice of pharmacy. The other vertical is about keeping the patient engaged and organized, is by our My Health Pocket. Being a doctor, being firsthand in the healthcare system, I know how important it is to have the right information available at the right time to save lives sometimes. With a very simple example, let's say if I ask you, what are you eligible? Or let's say not you. I mean, in my case, let's say a dad is taking if my husband has to take my son to emergency room, God forbid, for anything, and he's asked, is your son allergic to anything? His answer would be no, he's not allergic to anything. Whereas my son is severely allergic to penicillin. And he's like, so there's layers of, severity of allergy, mild, but he's severely allergic from birth. And my husband doesn't know that medical history about it. In that case, if he has my health pocket, my MediPocket, what he just have to do, go there and give the right information, life-saving information. Yes, he's allergic to penicillin since birth. This is how he has reacted to penicillin. Doctor gets the right information, because penicillin is the broad spectrum antibiotic, which is the first line of administration. If they don't know what is, what the strain of the bacteria, this is the first is always given. So it's really critical to know the right information to save lives. Sometimes, I would say most of the time. This is how MediPocket is going to empower patients and their family, that the right information is available at the right time when needed. With the help of MediPocket, they can store their health information in the most simplified format, not in the format like EHR is done, which is sometimes even hard for doctors to read. So it's like a simplified format that you can store, you understand, and you can use it whenever needed. The third, and actually the fourth component, which is the most interesting, and I'm very much looking forward, is Dr. AI. What Dr. AI would be is your symptom checker. It's not any simple chatbot or a symptom checker where you're just putting the questions and the answers, and then they give you the probability or the analytics about your symptoms. This is a little different. It's very hyper-personalized. It's very much simulating a doctor, because when you go to the doctor for any doctor visit, it has three components that a doctor take care before giving you a diagnosis. It's like physical examination, then, physical examination, then they have your records with them, or they can request your medical records. And then the third one is obviously the Q&A that they are giving it. Now, the lab works also. So now we cannot do physical examination because it's on the app, they cannot do it. But what we are doing it hyper personalized. We have your health records on it. We have your medical history, the medication history that you are doing it. Based on these components and then the QA, the system, the algorithms make it analyze all the three components together, not just completely based on your understanding of your symptoms, which could be sometimes discrete, which could be sometimes fragmented or inaccurate. It combines all these factors and give you a hyper-personalized probability of your symptoms, and then it gives you three call to action. That based on this, it out of 100 people has this symptom and they did this. So we just not only give you the predictive diagnosis, but we also give you call to action. Do you need to go to emergency room? Do you need to call 911, or you just stay at home and relax? Things like that makes it more a screening process instead of going on Google, which is the last thing you should be doing when you're going for your medical symptoms, because it always comes with three results. It's like either you have cancer, heart attack, dying tomorrow. Don't go to Google. So this is designed by doctors, pharmacists, the system, the algorithms, and this is going to be your screening process to take to know like what should be your next step. Do you need to make unnecessary visit, or you should unnecessarily avoid it? Like both ways. Sometimes people avoid it too much, or sometimes people overdo it too much. So that is going to be I would say a screening or a filtering process for them to get that peace of mind in the middle of the night, or whenever they have something like that, they can go to use Dr. AI. So again, this is the micro care ecosystem that MediPocket is creating.
I don't know. I was like sitting there and I was truly amazed by everything you were talking about, because this is the type of stuff you see in television shows or movies with stuff from the future. And to think that we're so close to achieving that is really crazy. Which is why I was wondering, what do you think the potential for AI has in the future for our society, especially in healthcare?
I think generally healthcare adapt everything in technology the last. AI is something not new. It has been there in the market, adopted by other industry very well, and we can see that it made the other industry very efficient, be it the e-commerce industry or any industry. The AI, first of all, got adopted very last in healthcare. And I would say the most reluctancy came from the providers, the doctors. It's not that the doctors are against it, but first of all, we are not tech savvy people. So if you asked us to for anything about technology, we are the last one. Give us the big books, we will read it. But if you give us a simple software, and we're like, no. So doctors were reluctant. And the other fear that sometimes goes in the healthcare system is that AI would replace doctors, which never happens, because the AI, what it would do, it will augment physicians. It will help them to better treat people. So it will be more augmenting, not replacing the doctors. There's a very big, as far as you're saying, what is the scope? It's gonna make our healthcare system really efficient, because we are deficient right now, comparing to the providers to the ratio of the care that should be given. So very disproportionate right now. AI is gonna help in that. The right care would be provided to the people in more efficient way with the use of AI. AI can be used in multiple areas, and it is being used right now, and more efficiently, I would say, in a higher level in healthcare, like the MRIs and stuff like that. They are the ones that is the technology or the AI is going to use, is being used. But this is not what day-to-day interaction of you and me with the healthcare system is. Nobody goes every day to MRI, right? The people daily interaction is with the primary care system. We need to bring the technology, we need to bring the AI to the primary care level. That is where the day-to-day interaction of people, even with the pandemics and epidemics, when happen, it's primary care which is first that needs to handle it. And AI would help it in various ways, in the patient care, in providing in the adherence level, the drug adherence level. It's the doctor cannot keep, or the nurses or the caretakers cannot be engaged in providing that, okay, you need to take this at this time, or taking how the drug adherence is going. We can easily do that with the use of AI, which will help you to stick to the adherence, and then also the other parts of it, like not just the adherence, but also, let's say, just for a very with one example, which obviously not yet done, but that is what I would be working after Dr. AI. For example, you're taking certain medications, not knowing, because you would not be calling doctor every time before taking certain food or certain kind of a drink, right? If you're on a medication, you just either do it or just go to Google and try to find about it. How about if the AI knows your medical history, knows what you're taking on a daily basis, and let's say if you're going for any kind of a wine or any kind of a drink which you have not taken before, it's new to your system, but the drugs are there in your system you're taking, and the AI can I would say give you a notification, or give you an insight. Okay, if you take this, this is how it's going to interact with the medication you're taking ahead, before even there's a side effect happens or a reaction happen. It can give you ahead a signal. It's like, okay, this can interact this way. We would be saving a lot on the healthcare burden, not just on the health of a people, but on the healthcare burden, avoiding that thing to happen. Because once the reaction has happened, you would be rushing to the urgent care again, which could be avoided beforehand if we have an AI infused in our system to that level. It's still a little far, but that is how we can work on applications and bringing AI to the healthcare system.
I love how you focus on prevention, because I feel like a big part of why maybe people are spending more on healthcare than in other places is that they put it off until their disease or their condition becomes so much more worse, and they have to pay much more than when they had to prevent the disease. And like you said, with the drug interactions, like for example, buying an alcoholic drink or any other type of food or tea, for example, that would really benefit people with being able to prevent any complications from happening, and they would be able to guide themselves on what they can eat and what they can't. So as of right now, COVID is a really large problem and a largely medically related one. Do you think that your MediPocket has had any impact on the pandemic, or how can such applications of your technology shape the future of healthcare?
Sure. So talking about currently that how MediPocket has helped in this pandemic is more on a financial burden side because the COVID is about prevention. I mean, the cure we know it's still not. There's no definitive cure. It's all been about prevention that is being focused. So it's more preventative than curative right now. So how MediPocket has helped in that is on the financial side because this pandemic has not only brought a burden on the healthcare system, but also on the economy around the globe. People have lost wages. The businesses have lost businesses. So how the MediPocket has helped is like helping people in this condition to still afford their medications. People have lost their insurances now, but they still need the medication for their chronic illness, whatever they were having. So with the help of MediPocket, they can still maintain that. They can still adhere to their treatment as it is without worrying about insurance. So that is one major thing that we have helped in this pandemic, and we have seen the traction again more because again savings. So that is what we have helped in one way. The other way that we have helped is about the delivery, getting that on-demand delivery, because again in this case it's a fear of people to be outside around other human beings. So it has minimized everybody's trying to minimize that kind of exposure. So in case if you have to take a prescription drug, you have to go and pick it up. Sometimes for elderly people, they may not have a caretaker, considering because of pandemic, whatever the situation, they may not have caretakers that can go and do the pickup for them. They literally have to go out. They are the most vulnerable ones. I mean, supposed to be vulnerable ones before, but now it's even the younger ones are. But so to avoid that, what we are doing is the delivery. So they can still adhere to their medications again on the schedule or the refill or whatever is needed by getting it delivered on demand. This is how currently MediPocket is helping because Dr. AI and My Health Pocket is not launched yet. How in the future we would be helping in something like that. Hopefully it should be pushed before, if the pandemic used to be every 100 years. As per the timeline we know about this one, the other pandemics, the last one I was in 1919 something, 19 something, but that was 100 years. But looking at the current conditions, the things could have, unfortunately, the timeline would shorten. It could be next 70 years, 50 years, or it could be more shortened, which is fearful. So how with the applications like this we can do is by keeping people again organized. Once you know your health in your family, which one is more vulnerable ones, we protect them first, because it's all about if one person gets it, the whole family member will get, because pandemic is like, it's just speed of spread that it does. So we can prevent, like once we know this group of population is the most vulnerable, obviously when the MediPocket has that data, when needed in the condition like that, we can collaborate with the government, with the local government or the state government as like, okay, this is what we have. We can analyze that data. We can identify those groups that are more vulnerable, and we can accordingly address that, either isolating or whatever the role of pandemic at that time would be. And we can minimize this the infection spread. So I think that is one way that we can help, because pandemics are the ones that always comes with no treatment. That's why they are called pandemic. So we would not be having a treatment, but MediPocket has always been a bigger advocate about prevention, not about cure. So if we can prevent, the cure gets easier, because instead of treating 100, we may only have to treat 10 people then, because we prevented 90 to getting to that point. So preventative care is something that we definitely need. Right now, the global system is about sick care. We are treating people, as you just said, we treat people when they get sick. Even people go when they get sick. They don't worry about taking the care of their health before they get sick. Very few do, but that is what it should be. We need to be focusing about preventative care. It's health. Our health means, healthcare means we would be at one point in the life, we would get some kind of illness or disease. It's all about how can we be aware about it with our lifestyle, with our genetics, with our history. We can know quite a lot things that, okay, this could happen to me, right? Not talking about flu, because that is something can happen without even, you can't prevent a flu. You can in some extent, but talking about bigger illnesses, you can know about them beforehand in quite an extent. How about getting knowledgeable about it? How about getting engaged in your own healthcare to prevent, and then if needed to take to the step about getting it cured? So I would say this is the future of the healthcare needs to be, and MediPocket would be one of the part of taking it to that level is preventative care, not curative care, as I always say.
It's interesting how you're talking about increasing awareness, putting more of the responsibility on the people of preventing, any diseases that they may encounter in their future. And to us, having awareness is a big deal. So we would like to ask you, do you have any message that you would like to bring to bring to the attention of our audience in regards to making a change?
I would say get engaged in your healthcare. Don't get, because people, for example, young people, they leave it on their parents. The parents leave it on doctors or the healthcare system. The older people leave it on the caretakers. I would say everybody should take part in their own healthcare, get engaged. It is difficult. It's easy to be said, get engaged, but it's like, how is always a question. We are providing that solution. How is through my MediPocket. We are giving you a platform that is giving you a structure where you can get engaged. You can get your family members engaged. So how MediPocket is designed is My Health Pocket will enable the user to store up to 5 family members' health information, which would be shared. For example, as the caretaker of my family, of the health caretaker of my family, I can put all my, my kids and my husband and grandparents or whoever my family member is. I would be the one maintaining it, but I would give access to them for there. So they can have the input, they could have insight on that, but that is how we have to get the people engaged, because now we are providing them the platform. Because always the question that I came across before starting MediPocket, when being a doctor and clinically treating, and I was like, why you guys are not organized? Why you never bring your health records with you? I mean, sometimes the doctors don't say that often, but sometimes if you know that patient, you can be a little bit of like, why you always come without a discrete information about yellow pill, long pill, this pill? But now they are like, I mean, I can't carry my health records everywhere, but this is now you can, because if you can carry your phone with you, you can carry your health information with you. So I would say this is the information or the message I would say is like, at all levels, like young, old, or family people, they should get engaged in their healthcare with the solution that MediPocket is providing is My Health Pocket. Also, the medication, very important. Another thing that I want to point out on a medical perspective is like, sometimes because we cannot afford the first line medication, which is the choice of medication given as a first line by doctors, because when doctors write you a medication, they think this is the best for your health. But if you can't afford that medication, you will not take it, resulting in inefficient outcome. Instead of that, if your insurance is not covering a particular medication, before going for an alternative, please use the discount card. See if it can save you and still let you use your first line medication or the choice of your doctor. If it can, then again, obviously, you do not have to go for an alternative or for the process about approvals from the insurance. You can take the first line treatment. If not, then obviously there is a second alternative that you have to go in. But that is another solution is like, use the discount card for over-the-counter medications and the prescription medication to see if you can save.
I'm really glad you kind of mentioned empowering patients to kind of take their healthcare into their own hands, because I know as an individual in our society, I often feel like I have no control about what's happening in terms of my health, and I just kind of have to follow whatever my doctor says or whatever my parents tell me to do. And for our healthcare system to be moving in such a direction as MediPocket is showing us that it is possible, it's truly inspiring, and it kind of shows us that the world is going towards a better path. And to kind of just end on a lighter note, I was wondering what has been your favorite aspect working in this field, and what has been your least favorite aspect? And if you kind of had a chance to redo everything, what would you pursue differently?
My favorite part is that it's always changing. I mean, not changing. I would say it's something not boring. I like that. It's like, as in the very starting, we start the challenges. it's everyday new challenges, which I like it. It's like every day I get up, it's like, okay, now throw on new challenges on me. So it's like every day there's a new challenge that I have to face, that it gives me a different energy to go for it. So that's the interesting part for me, because I was always, before starting MediPocket, again, I was in a comfort zone being a doctor, right? I mean, if you're in a particular profession, you're in a comfort zone, you know what you're getting every month. It's like, you're comfortable. And my family is like, if you're in your what you wanted, if you're in a perfect thing that you wanted to be a doctor, you're treating clinically, you're making a good living, why you want to jump into something which is uncertain, it's very uncertain how we're going to do, and it's challenging, so much challenging. Why you want to do it? And my thing is, I need something that could make an impact. Clinically, yes, I can treat 1 to 100,000 people. How about I can make something that could help people globally? Obviously, would I be able to achieve to that level? Hopefully with time, but we need to take a step to it, right? Unless you try, you will never achieve anything. So it's like, let me try. So that was my thing, and I'm enjoying doing that. What is my least favorite part about is that people don't want to understand. The hard part, when you give these solutions to them, people just think like that healthcare has been like this for decades, and it will always be like this. There's no solution to it. This is how it has been. This is how it will be. There's no solution to it. It's really hard to tell them the systems have changed. We have seen in the past it would change, but we need to make a very collective effort. So it's really hard from the patient side, and seeing even from within the healthcare system, that it gets sometimes it is not taken as well that I would expect people to be taking it, or the system to taking it. So it's a little struggle, but again, it's part of a struggle which I enjoy. So good and bad part, I don't like it. The other thing that you asked, what if I have to redo everything? I mean, I still will be a doctor, I think. For some reason, I don't find myself fit in anything else. Do I started enjoying learning about technology. I'm educating. I'm not educating at the level of getting certified, but I'm educating myself with the technology, the technical terms and AI, and it's interesting to me. But would I do it as a learning, as a profession? Maybe not. Maybe I'll still go back to the same drill if I have to redo it as be a doctor. So yeah.
Okay. Well, that concludes our interview. Thank you for being with us here today. We really appreciate it, and I wish you best of luck in kind of motivating people to kind of see the positive good that this technology can create in our society. And just thank you so much for being here.
Thank you guys. And I like that as a young people, that's something you found interesting. Now let me ask you why you found MediPocket interesting before me telling everything.
Well, what I personally did is that, Rebecca and I, we go to a healthcare focused school, and Ayaan goes to a STEM focused school. So I was just kind of on LinkedIn trying to find interesting individuals who have a lot of experience in kind of improving the lives of other people through their technology and through their work. And I noticed MediPocket. So I kind of went on the website and I did a lot of research into what it was. And I'm like, wow, this is something really interesting. And this is something that we learn about in school, how healthcare is so expensive, and this is directly working towards addressing not only affordability, but also transparency and helping increasing accessibility to appropriate care with good value. I don't know, that was just why I was interested.
No, it's always interesting to know. So and I would ask three of you individually, but it's just always interesting when young individuals get interested to learn in healthcare, not just like healthcare to be just treating patient, but there's so many things, perspective of healthcare, verticals in healthcare, that we can still help people. That is the goal of the healthcare is. So what do you, in your profession, what part of healthcare you want to get engaged in?
I've always been interested in medical innovation, which is part of the reason why I was so drawn to your MediPocket and the use of AI, because I believe that communication between healthcare workers and patients have always been in the past, it was very personal. It was pretty much like one-on-one. They knew everything about each other. But now patients are being shuttled from one provider to another, to another, to another, and they don't know what's going on. And then as soon as they come back home, after going through that whole ordeal, then they're faced with the bills, and they likely don't have that many people to help them with it. So so when I saw your innovation, your MediPocket, I was really impressed. I thought that could really make a large difference in patients' lives, and making it easier, and making healthcare just easier for people to understand. And so hopefully patients aren't as scared of healthcare as they are probably now and in recently. So I just love what you do. So
Interesting. How about you, Ayaan? What are you not going in healthcare and anything, right?
Oh, actually, I am. I mean, I saw STEM, and I thought it was interesting. But really, like, I really want to become like a cardiologist and help people. But what I really, because like I'm not like exactly the best at coding, but what I want to do is to have my expertise in like me being as like a healthcare provider, and me being like a surgeon to help develop surgical robots. AI that could perform surgeries at precisions not comparable to what humans can do. And that's something I really want to like focus on, because not only am I helping people, but just by doing like my own work, but I'm also helping like increase and innovate the future of healthcare, which is exactly what you were doing, which is like really what really brought my interest into this.
Wow, interesting. Yeah, cardio. I mean, I'm an internal medicine and OBGYN, and before I was actually literally was in cardiology for 1 year, sorry, before I was like, you know what, I better be doing something different than being a cardiologist. But that is, if I would have not done MediPocket, I would have become a cardiologist eventually, because cardiology is a very interesting field. It's not, in OBGYN, it's one set of patient, which I'm not saying is wrong. I did it for 2 years, but again, for my thing is I need something changing every day. Cardiology is something that gives you challenge every day. It's different set of patients. So that's interesting. And how about you, Aqsa? You tell me, what do you want to be?
So growing up, I was always told that, oh, you should be a doctor. You have like 3 options: doctor, engineer, or lawyer, right? And I do want to go into healthcare, so I chose healthcare. But as like I'm exploring these fields, I'm realizing there's so much to healthcare than just being a doctor. I can go into medical innovation. I can go into research. So right now, my plan has just kind of been to kind of major in bioengineering and see where I go after that. Maybe I'll pursue medicine, get an MD, and then we'll see. But I do want to go into innovation and kind of create meaningful change in people's lives.
That's important. Very good. It's very interesting what all 3 of you have in mind and, working towards. Good luck for that. And I enjoyed talking to you guys.
Thank you.
We enjoyed talking to you too. You gave such a large insight on what it must be like to run such a huge project and experimenting and reaching out, even when you have stability on your side. You just want to keep pursuing. I think it's great.
Yeah, thank you. But yeah, thank you guys. Take care and stay safe and healthy.
Have a nice day.
You too.
Have a good day.
Bye.
Bye.